Sure. All right.
Okay,
Hi, friends.
so I'll just give an introduction. I am Dr. Sibi. I am a recently GMC registered doctor. I'm currently working as a duty medical officer in Chennai. And my colleague here is Dr. Manikandan Tannapal, and he is also a recently a GMC registered doctor. And today's session is going to be about counseling stations in PLAB. And we hope that you will have a very interactive session, because if it is a one-way session where we give you lectures and we don't get any response, it's usually very boring. So I hope you get the most out of the session, and I hope you interact well with Mr. Manikandan and get the best out of this. So over to you, Manikandan.
Yes, thank you, Shibi. Hi, friends. Hope you're all doing well. And as my colleague Shibi told, now we are going to discuss about the counseling stations in PLAB-2. Could anybody please confirm if I am audible clearly? Yeah. All right. Thank you. So, the counseling stations. So, in PLAB-2, as you're all aware, we'll be having 14 stations. And out of them, a good number of stations will be those where we have to explain things to the patients. So, what could be the tasks in these kind of stations? Number one, it can be explaining a medical condition, say, for example, diabetes or hypertension, gallstones, hernia, or something like that. Or it could be to explain the treatment of a particular condition. Say, for example, a patient wants to know about the treatment of his diabetes or hypertension. So, in those stations, you will have to explain the treatment of those conditions. And number three, it can be particularly about the uses and side effects of medications. So, for example, steroids, one of the medications which patients are commonly concerned about. Patients may be having concerns about steroids or hormonal therapy or contraceptives, and you have to be knowledgeable about these conditions so that you are able to explain the uses and side effects in the simple terms. And finally, while you're explaining these things, patients may have concerns. Either they could have had concerns before they came to you, or concerns could arise from what you explain to the patient. So you must be in a position to ask and address those concerns, whatever concerns the patient might have, because in PLAB-2 stations or in any OSCE stations, the main goal is to address the concerns of the patient more than the medical and other things. So, what do we need to shine in these kind of scenarios? We need to have good basic knowledge about the condition, because only if we have the knowledge, we will be able to explain those to the patients. So, you have to have a good grip of understanding of the common conditions which are available in GMC blueprint, and you need to have the ability to communicate clearly in a crisp and concise manner in pure layman terms, and please avoid medical jargon, because that is very costly. And if the patient doesn't understand something which you say, and if the patient asks you to repeat, or if the patient asks you to explain the thing which you told, it can cost you two things. Number one, it can cost you the time, because patient asking again and you repeating the same thing again will cost you some at least 15 to 20 seconds, which are very crucial because PLAB-2 is a time concise exam. And number two, it will not sound very good if you are not understandable to the patient, and it again doesn't give a good impression if the patient doesn't understand you in the first go. And number three, you need to have empathy, like in any other scenario, in any other PLAB-2 station or in any other OSCE station. You need to have the empathy, the real empathy, and you have to have the ability to address the patient's emotional responses. See, some patients might suddenly get worried, or they may become anxious, or they may stop speaking once you reveal certain diagnosis. And in those scenarios, you must address those emotions appropriately and actively pick up emotional cues which are consistently given by the patients. Right. So, how do we manage our time in these stations? As you know, PLAB-2 stations are 8 minutes long, where we have separate marks for data gathering, management, and interpersonal skills. So, in these scenarios, counseling stations, where our main focus is on explaining things, my suggestion is that you minimize the time you use for data gathering, which is 2 minutes. Like you can ask short histories, which we'll come to later in the coming slides, how to ask short histories. And apart from the 2 minutes which are spent for data gathering, the remaining 6 minutes which you have in hand should be exclusively directed towards management and addressing concerns, because that is where you are required to perform the most. Because that's where you'll be able to address the concerns of the patient. That is more important than asking a wide history in these type of stations. And please remember that this 2 plus 6 formula is always flexible. It is not constant, and it is not an official recommendation by anybody, but it is flexible, and you should use it accordingly and use your presence of mind in the particular scenario to alter it anyway, which helps you. Right. So now let's see how these kind of scenarios are different. And let me use the cursor for this. And so in routine stations, what happens is, so say for example, if you are in a diagnosis station, say if the task is like 55-year-old Mr. Peter comes to you with abdominal pain, talk to him, elicit history, and give appropriate line of management. So these kind of history taking scenarios are totally different from what we are discussing now. So if it is a history taking scenario and where you have to arrive at a diagnosis, you will spend most of your time from in getting information from the patient. So the flow of information will be from the patient to doctor. So it will be from the left hand side to the right hand side in these scenarios. Whereas in these counseling stations, which we are discussing now, you will most cases you will already have the diagnosis and you will already have the management plan. The only thing you have to do is to explain and educate the patient about the diagnosis and the management. So in these scenarios, the focus of flow of information is from right to left. It is from the doctor to the patient. So it is this way, the doctor to patient, rather than the patient to doctor way. So just have that in mind, and let's move on. So as I mentioned earlier, we need to have some kind of background knowledge about common conditions so that we are in a good position to explain about these conditions. And where do you find these common conditions? uh, as we have mentioned in our previous meetings, and if you are this is the first time you're attending the meeting, and please refer to the GMC blueprint, which is available on the GMC website, and it will have GMC blueprint for PLAB. Okay, and in this GMC blueprint for PLAB, you will have a set of scenarios here, a list of diagnosis and list of symptoms which are tested in the PLAB exams, both in PLAB 1 and PLAB 2. So, have an idea about what are the conditions which are present in that list of GMC blueprint, because those are the exact things which are going to come in the exam. And also, there is a website called NHS Health A to Z. And in their website, NHS website contains all the necessary information which are to be communicated to the patients. And that is a golden gem. So you can basically use it for any medical condition for the PLAB exams. And it is enough that only you give the information which are present in the NHS website. That is more than enough. And how much information should you know? So to answer this question, you just ask yourself what information you would like to know if you were the patient. Say, for example, if you were the patient and if you are going to the OPD or if you are admitted in the hospital, to what extent would you want to know about your condition, and how would you want to know about the condition? In what tone you would want to know, and how would you want your doctor to be behaving with you? So that's exactly how you have to behave to your patient in the exam and also in real life. So this is something which you can keep in mind and which could be quite helpful. Right. So, what should we learn about? So, for any condition, learn about the incidents, Yeah, at least for common conditions like diabetes or hypertension, gallstones, and things like that. Learn the incidents because some patients will ask about how common is this, doctor, or is it rare, or is it quite common that you see it every day? So, in order to answer these questions, it is a good idea to know about the incidence of common conditions. And simple pathophysiology in layman terms, please don't make it complicated like what we do in our final year medical exams or your entrance exams. It's not like that. And keep in simple layman terms. For example, if you are explaining diabetes, avoid medical jargon and use simple terms like Mr. X. Diabetes is a condition where your body doesn't appropriately process glucose. So whatever you eat, it becomes ultimately into glucose and it is used for energy. Unfortunately, in diabetes, this glucose is produced, which is produced, is not able to be converted into other materials which are stored, and due to some hormonal imbalances. You can use words like insulin because most of the patients will know what insulin is. And in case you are explaining type 2 diabetes, you can obviously tell that the insulin in your body is not working. That's why your body is not able to convert glucose into glycogen. If you don't want to use glycogen, again, that's completely fine. And you can use other terms like the glucose is not able to be stored in your muscles or other parts, so that the glucose remains in your blood, and this can lead to serious consequences in the coming years of life. So, this is one way of explaining diabetes, and again, you can have your own way of explaining diabetes or hypertension or anything, but please make sure that you use layman terms and not complex medical jargon. And about complications, most of the patients in PLAB-2 and in real life will be very worried about the condition they have, and they will ask about what if we don't get treated, or what are the risks of having this condition. So it is a good idea to know about the potential complications. Again, these have to be evidence based. Please refer the NICE guidelines or other reliable sources of information to know about the complications of the conditions. And again, you can refer back to the NHS websites. For example, the complications of diabetes or diabetic nephropathy and diabetic retinopathy. Again, you need not use the exact medical terms because patients can become confused and perplexed when they hear the terms. So you can tell them that, Mr. X, if you have diabetes over a period of time which is uncontrolled, there are chances that it might damage your kidneys and eyes, which are often very serious. So use words like that and explain them in a simple manner. And about management and prognosis, again, make it simple. Tell about insulin and tell about the medications which you can give. And most of the patients are aware of insulin because that is not something which is very scientific. And you can use insulin. And about medications, you can tell about the oral hypoglycemic medications which are available in simple terms, and prognosis about how the prognosis of the diabetes is and how it is. When it comes to management, one thing which you have to include is lifestyle modifications, especially when it comes to chronic conditions like diabetes and hypertension, because that is something which are more effective than medications, as per recent studies. And it is highly essential that a junior doctor tells the lifestyle modifications first and then comes to the medications, because lifestyle modifications are easily done by patients, and which makes the patients feel empowered that they have control over the disease. So please remember lifestyle modifications for hypertension. Please remember telling them salt restriction and other dietary modifications. And for diabetes, tell about the meal plan and to avoid dietary sugars and to improve fiber-rich diet and things like that. And effect on quality of life. This is something which we don't study usually in our medical schools, and we are not tested on those things in your medical school exams. But when it comes to exams like PLAB-2 or other OSCEs, it is pretty important because we are treating the person per se as a whole, not the individual condition or disease. So, for example, if Mr. X has diabetes, we are treating Mr. X, we are not just treating diabetes, we are treating Mr. X. So, how does diabetes implicate his quality of life? Say, for example, Mr. Y. Mr. Y has epilepsy, seizures, and for which he is going to be started on medications. Let's assume that Mr. Y is a driver. So, for a normal person, the impact of seizures or epilepsy can be different. But for Mr. Y, who is a driver by profession, this is going to affect his livelihood because there are certain conditions like seizures and transient ischemic attacks and something where people can't drive regularly, like as you and I do. So the effect on quality of life is very important because it can it can affect the management and it can affect how you perform the station in the last 3 minutes or so. So, say it's not only about driving. For example, if the patient is a teacher and if the patient has some issues with the voice, again, just if you see that the patient having sore throat or some issues with the voice doesn't give a big alarm. But however, if the patient has a concert tomorrow, if the patient is a singer, and if the patient has a concert in the coming weeks, that's a huge difference which can make to the patient. So effect on quality of life is very important, and that's how you can stand out from the crowd, and that's how you can score more in these stations. Right. So what if you are unsure of the answer? What if a patient asks something and you don't know the exact answer? What do we do in those conditions? So my advice would be, please do not speak if you don't exactly know what the answer is, because a wrong and misguided information is very costly and it can be sued anytime. And so it is highly, highly recommended to be honest and acknowledge that you don't know. State that you do. There is nothing wrong in admitting that you do not know. Nobody can know everything. And if you don't know something, please feel free to admit and acknowledge it, and the patients will really appreciate it if you tell them that you don't know, because ultimately patient safety is the most important thing. Your or knowledge is not very important than patient safety. So what you have to say is, state that you do not know, but assure them that you will do your best to find out. You can escalate to your seniors and you can seek help from them in these conditions. Yeah. So again, please remember patient safety. If you don't know something, please admit that you don't know and tell them that you will do your best to find out what's the right thing to do in those conditions. Right. So these are the general things which we talked about how to approach these stations. Now we'll move on to how to actually approach and actually perform on the stations. So first, when you're given that task and when you enter the room and when you initiate the consultation, start by clearly stating your name and role like you do in any other PLAB-2 station. Sorry. And number two, you establish rapport and demonstrate active interest in the patient's concerns. So this is where you will determine how the station goes. If you establish good rapport and if you're genuinely interested in the patient's condition, and if you're genuinely interested about helping the patient professionally, and the patient is going to be very, very comfortable with you. And if the patient is comfortable with you, they are going to give out all the information you need, and you will be in a better position to handle them and explain them. So, rapport is super important, and please demonstrate active and genuine interest in the patients, right? And pick up how the patient is feeling. In some conditions, when the patient is told the diagnosis, or sometimes when the patient can have something in their mind before coming to you. So some patients might be anxious, and some patients might be worried, some patients might be perplexed and confused, and some might be happy, hoping that everything is fine. So pick up how the patient is feeling, what are the emotions of the patient, and take your approach from there. If the patient is feeling anxious, reassure them that you are there to help them at any cost, and take your approach from there. If the patient is worried, again do the same thing. Let them know that you are there for anything it can be, and take your approach from there. And similarly for any other condition. So pick up how the patient is feeling and tailor the station according to the patient's feelings. Right. So as I mentioned earlier, we will have the session on 2+6 basis, where 2 minutes are used for data gathering or history taking and 6 minutes for management. So how to use those 2 minutes to take a rapid history? So in most of the stations, this that will be the first time you are meeting the patient. So it is completely okay to request the patient to walk through what they have experienced so far. So you can say, Mrs. Y, Mrs. Y, since this is the first time we are meeting, and could you please just walk me through what has happened so far? So that's something which you can use in these conditions. And what are the things you have to assess? Ask the patient to recap of whatever happened before and try to elicit if there are risk factors. Say, for example, if the patient is having gallstones, try to elicit risk factors as you all are familiar. The five waves: fat, fertile, 40, and females. Does the patient have frequent fatty meals? So that's one of the risk factors for gallstones. Similarly, hypertension, salt intake. Does the patient often have a increased salt in their diet, or does the patient have a family history of hypertension? And for diabetes, does the patient have a family history of diabetes? Is the patient obese? So when you're eliciting the history, try to elicit risk factors, because you will be in a better position to explain that in the management. And also try to elicit the red flags. Say, for example, if there is a patient with hypertension or high blood pressure, the red flags will include headache, changes in vision, and any new onset of new symptoms like chest pain and things like that. So, recap: risk factors and red flags. These should be your mantra while you are taking a rapid history in counseling stations. So, apart from these three things, you can elicit any other relevant things which you think which would influence your explanation when you're giving the management. For example, if the patient is an elderly, and if you're concerned about his safety at home, you can elicit about his living, social history, whom does he live with, and does he need any support. So things like that are completely subjective, and we can't predict what are all the things to ask in the station. So um, don't rely on mnemonics or any other formulas to elicit histories, and cater, have a checklist and have a set of framework in your mind, but don't apply them blindly, please. And according to each station, according to the relevant context, take your approach from there. Individualize approach to each stations depending upon the need. All right. So after initiating the consultation and after taking a rapid history, what we have to do now is elicit the patient's ideas. What does the patient already know? So almost all the patients will have some kind of preconceived ideas about the symptoms. For example, a patient having chest pain will always, in most cases, will might be afraid of having a heart attack or myocardial infarction. So almost every patient will have some kind of idea about the symptoms. So please ask them, Mr. Y, do you have any idea of what might be going on? Or Mr. X, do you have anything in your mind about what could it be? And so again, please don't use it like a checklist, and some patients might get offended. Oh, doc, you're the one who has to elicit that. Why are you asking me? So, in order to avoid those kind of responses, use it at the appropriate time by eliciting the patient cues. You need not use that in this order. You can ask about the patient's ideas literally any time in the consultation, any time in the 8 minutes. Yeah. So, and the second thing, some patients might be actually underestimating the severity of the symptoms, and some patients might have disproportionate or high anxieties which are not required. Again, this has to be elicited during the consultation, and it has to be addressed accordingly. Right? And number three, in the recent days after the advent of internet, almost everybody would have searched something about the symptoms on internet. So it's a good practice to ask, Mr. Y, did you Google it up your symptoms? Did you find anything? Though it is not that you are encouraging Googling the symptoms, but just to ask if the patient had Googled, say, for example, if the patient has Googled abdominal pain, and the internet might have given him any information ranging from simple peptic ulcer to cancer of the stomach. So it is a patient might be might be in fear that he might be having cancer because he googled the symptom. So it is a good practice to ask if they have googled their symptom. And again, please don't discourage patients from googling symptoms blindly. Instead, direct them that, Mr. Y, it is very good that you are super health conscious and you literally try to know what's happening, and I really appreciate it. However, internet has a lot of unauthorized information, so it is highly a good practice to check the NSS website, because NSS website is accredited and it is an official UK government's health website. So use the NSS website to to check on your symptoms or check on about any disease or any conditions. So just don't blindly bar the patient from using internet. Rather, direct them to authorized and useful websites like NSS or Royal College websites like that. So this is about eliciting the patient's ideas. Now, coming to patient's concerns, what is the patient worried about the most? Elicit associated concerns. As I mentioned earlier, a patient with new onset seizure or a patient who has been recently diagnosed with epilepsy, if he is a taxi driver by profession, then it is going to affect his livelihood. So it might be the patient's concern in his mind. So we will be more focused on treating the epilepsy. However, our focus should be on treating the patient, not the condition. So eliciting associated concerns is a very important thing to treat the patient as a whole, because in this condition, Mr. Y, who was a taxi driver having new diagnosis of epilepsy, he is going to lose his livelihood at least for some days because he can't drive. So in those conditions, we have to refer him to the appropriate social measures, or we can refer him to the appropriate employment service so that they can find him a different profession so that he can be financially supported. And if you are in doubt about these financial and non-medical things, you can always tell that, Mr. Y, I know that this can affect your job. However, let me consult with my seniors and get back to you with the best program for you to support your livelihood for the coming days. So that's something which you can do. And you have to mention about DVLA in these scenarios, because driving and epilepsy are, are not very smooth to go with. So the DVLA has to be informed, and actively seek the patient's cues. So not everybody will tell their concerns openly, like anyone. So some patients will be very hesitant to reveal their concerns, especially in cases like domestic violence. So patients will not be opening up very soon unless you ask them specifically. So, but the patients will be giving some cues. They may not be having good eye contact, or they may be looking down, or they may look worried. So these are some patient skills which you have to pick up and ask them, Mr. Mr. Razak, what's happening? Is everything all right? And you look so worried. Could you just let me know what's happening, and I will be in a better position to help you? So things like that. You can make your own sentences and ask. And again, as I mentioned, they may not open up unless you specifically ask. So please ask the patient's concerns. This is not only in PLAB 2, but even in real life. Not everybody will open up unless you ask. So please have that in mind, and cater your management such that it addresses all concerns. It's not just about treating that particular medical condition which the patient has, it's about treating the patient as a whole, addressing the physical, mental, and emotional well being of patients. So, coming to the next, right. So, explaining the condition. How to explain a condition? Consider the positive consider the possible implications of the diagnosis. As I mentioned earlier, a taxi driver having epilepsy is having an implication on his livelihood. So things like that. Be sensitive and empathetic accordingly. Again, you're seeing a patient who's going to lose his livelihood because of the condition, who is going to have someone who is going to have professional change. Say, for example, if the patient had been driving taxis for the past 2 decades, and if that's the only job he has done all his life, and now if he had got epilepsy, and now if he's in a position to change the job, that's not an easy task. It's not an easy task to give up the job which he has been doing for 2 decades and shift to a completely different job. right? So that's not easy to go through. And if you tell these things to the patient, Mr. Y, I can see that um, you are really worried because a job change is not as easy as it sounds. So, however, we are in a position to help you, and we will do our best so that you are making a smooth transition. And if you give some empathetic sentences like that, and if you're genuinely concerned, and if you're genuinely interested in the patient, and that will be a good practice, and patient will be happy and reassured if you are, expressing empathy. And it's a good practice to recap the symptoms and check if they are accurate. It's like paraphrasing the symptoms in your words. So just to check if the patient, if you have grasped everything which are told by the patient. And again, as I mentioned earlier, reiterate the risk factors now. So when you're explaining the condition, check symptoms and explain the condition. And when you are explaining the condition, also include the risk factors. Say for example, if you are explaining hypertension, say for example, so Mr. Y, from the data which you have, from the information which you have given, and from the blood pressure readings, and i I expect that it looks like you are having a condition called hypertension or high blood pressure. And now you can tell the risk factors, like you mentioned that you have a your father or your mother had a blood pressure as well, and your diet included a good amount of salt, and these are the risk factors which could have contributed to the condition. And then you start explaining the condition. Again, risk factors not necessarily tell them at the beginning, you can also tell them at the end, and it's completely up to you of how you explain the condition. But we have to tell the risk factors if they are present. Yes, coming to the next, imparting the information. How will you impart the information? Use clear languages, very short and simple sentences, right? So not very complicated, or not to show your vocabulary in English. It's not, this exam doesn't test your vocabulary. So please use short and simple sentences that anybody can understand. Avoid complex medical jargon. Please, please, please. This is something, even the word hypertension is jargon. You can use high blood pressure, which is more simple. And utilize appropriate pauses. So you'll always have to pause between sentences because patients might not be following what you're telling, right? So because they are not medical professionals like we are, so we do follow fast sentences, medical information, but for patients, it can be extremely difficult to follow medical information in the speed which we usually communicate. So speak slower than you usually do when it comes to explaining conditions, because these are quite important, and utilize appropriate pauses between your sentences or phrases. Prioritize important points because time is an important factor. So wisely prioritize your time. Tell the important things first, which are very costly and which can't be missed, and then play the less important things in the coming points in the coming time. And chunk and check. So this is something which should be done every time in every station at every stage. What is checking and checking? So say for example, if you are telling about explaining high blood pressure, and you have to chunk and check in between. So Mr. X, are you able to follow up to what you were told? And it's a good practice that you can ask the patient to repeat what you told. So for example, if you can explain about high blood pressure, and you can ask the patient to repeat, Mr. X, are you able to follow? Can you please repeat that for me so that I can be assured that you completely understood it? That's something which you can do. And please chunk and check at frequent intervals and make sure that the patient and you are in the same page. Otherwise, if you recite 10, 12 lines and for a minute or two, and at the end of 2 minutes, if the patient is staring, showing that he understood nothing, then that's complete waste of time, which can be serious. So please chunk and check understanding of the patients. They should observe whatever you're telling. New concerns. So once you explain the condition, though you have asked the concerns before, once you explain the diagnosis, the patients might have new concerns which have come now because of the diagnosis. So you have to ask for them. Mr. X, do you have any concerns now? And be prepared to address them. and have a thorough understanding of non-medical management. As I mentioned earlier, non-medical management include lifestyle measures like diet and lifestyle modifications and exercises and meditation, yoga, whichever and whenever relevant. So for each condition, have a thorough understanding of the non-medical management and lifestyle modifications, because that is very important, and a junior doctor is expected to be completely thorough of all the non-medical management of common conditions. Right. So now, after explaining the condition, now it's time to agree on a management plan. When it comes to management, patient should be included as a part of the management plan, and it should be a teamwork where you and the patient are working together as a team to decide the management. So it is a shared course of action rather than being a one-way or doctor-centric communication where the doctor is behaving like a boss and the patient is behaving like an employer, simply following the boss's instruction. No, friends, that's not how it works when it comes here. Um, and our patients are a team and we function together. So it's called the shared course of action. So here we are laying the management options. For example, if the patient is having hernia and if the patient surgery is the only option, and we will be laying the management options like undergoing a surgery, whether it is open or laparoscopic, and if the patient doesn't want surgery, and we can tell about how to if the patient if it doesn't disturb their lifestyle, then we can advise the patient if it is safe to postpone the surgeries. And again, so we have to lay the management options and we have to tell the pros and the cons of each option and let the patient make a decision, and we have to give our support in helping the patient to decide their line of management, right? If the patient asks, doctor, what do you think is the best thing, then it's a different scenario where we can give our opinion. However, the ultimate decision should be made by the patient, and only if they are aware and if they give their consent, we will be able to deliver the management, right? So just because the patient doesn't want a management which is the actual standard of treatment doesn't mean that we should force the treatment or the patient is not making a good decision. No, there is no right or wrong decisions when it comes to here. It's completely up to the patient, and whatever decision the patient makes, we have to accept the decision and we have to move on, provided the patient has the mental capacity. But it's very less likely that such complex patients arise very frequently. So you don't need to worry about that. And you will pick up mental capacity things right early in the station, because the patient's flow of information will be in a different way. So don't worry about that. That's something which you have to have in mind in real life. And number three, as I mentioned, involve the patient in the decision making process, because patient and we function as a team, as a unit, and to make the patients feel empowered, and they should be having they should feel that they are empowered rather than being pessimistic or being passive. If you make the patients feel active, and if you're actively involving them in the decision making process, then that's going to help them positively in the healing process. And that's called patient centric care, which the NHS is accounting for, and this is becoming a very common and point of discussion about patient-centric care. Almost every trust is focusing on it, making patients as the center of care rather than doctors or management being at the center. So, how to give further information? So, once you explain the condition and once the patient is happy, when you're closing the consultation, you can give further information by patient information leaflets, which are available literally for every condition at every trust. And you can direct the patient to NHS Health A to Z website, which we were discussing before, which has the required patient information for almost all conditions which are common in the UK. And there are support groups almost for every condition. You can Google about them, and you can refer the patient to the relevant support groups where the patients can meet fellow people who have the same condition, and they can share their experiences of having the condition and undergoing the treatment, how to cope things, and how they can learn from each other's experiences, which can be a useful exercise. And number four, patient stories in authorized YouTube NHS channels. So this is similar to support groups where the patients can view the stories of other patients who are having the same conditions, and sometimes it can empower the patients to go through the condition. Right, friends, we have come to the end of the session. Do you have any questions? You can feel free to unmute yourself, or you
Oh, I
can type in the box.
So I think Mr. Manikandan gave you a very good idea about counseling stations. I know it's a brief presentation and there's a lot of topics to cover in, but I'll ask the question first. To start with the Q&A. How do you compress all of this into 8 minutes, Manikandan?
Yeah, thanks for the question, Sibi. Like we discussed, it's basically a 2 plus 6 formula, and it's not a very easy task to compress everything in 8 minutes. Again, it's depending upon the scenario. So, for example, if the station is about explaining medications, in those conditions, history doesn't make a big difference, right? So if our task is just to explain the medications like steroids, so in those stations, we can completely cut down on history, like or take a very brief history of just what to know what happened before, and we can focus all the remaining 7 minutes on explaining the medications and addressing concerns. Again, it's a very broad question which has a very specific answer. Depending upon the scenario, we have to cater the time. But having the 2 plus 6 formula in mind will greatly help. And yeah, risk factors, recap risk factors and red flags, and moving on, asking the patient's ideas, concerns, and moving on to the management plan involving the patient in the decision making process. That's how I would go about it. Starting in the chat box. Any other questions, friends? Does anybody have any other question?
Dr. Preeti, Dr. Mahi, Dr. Razana, Dr. Arigaran, we want to interact, more, and we want you to get most of the session. So any of you have any questions, feel free to ask.
Yeah, and there are a couple of stations which, if you would like to practice, which are in the coming slides. There are two stations, so if anybody could volunteer, if you don't have any questions, we can move to the stations as well. But if you have questions, please feel free to ask them now, so that it can be in a better way.
So from my experience in counseling stations, what I would suggest is make sure you don't, sit with the patient and try to pretend or try to come across as someone who knows it all. Listen to the patients, carefully and empathically, and if the patient gives out any information which is wrong, try to correct them in a very nice way and advise them very, very precariously. Don't promise them anything, and give a very real idea of what the patient is going through, or what are the conditions, or what is the medication side effect, so that patient knows everything, gathers all the information, and then asks you questions. Yeah.
Yeah,
I think,
excellent.
Manikandan, we can move on to uh, you know practicing if no one has any further questions.
Yeah, perfect. We can do that. So, coming to stations. Okay, so let's have a volunteer. Friends, does anybody like to volunteer? Is anybody happy with that? This is a pretty straightforward scenario. It's which is very easy to do, and if you could volunteer, it would be great. Is anybody willing to volunteer, or should we pick someone? Sibi, should we pick someone? All right, let me go through the scenario. So you are an foundation year two doctor in the GP surgery. So GP surgery is a general practice where it's like a primary care where the patient comes. The first point of contact of patients with healthcare is the GP surgery if it is a non-emergency condition. So here, Mr. Adam Cook, a 52-year-old businessman, was found to have an ambulatory home blood pressure of 166 over 104 millimeters of mercury. He is waiting to be seen by you. Talk to him, suggest a management plan, and address his concerns. This is the task, and this is a pretty straightforward and easy task. If anybody is willing to perform, we can go ahead.
Hi, doctor. I can try if
Oh,
you don't
that's great.
mind.
Thank you. Yeah, we don't mind actually. So yeah, good. Good. And can I know how to pronounce your name, please?
I'm Yvonne.
Yvonne. Thank you, Yvonne. Yeah. Shall we start?
Okay.
Let me switch on the timer, please, for you. Give me a second. All right. All right. Thank you, Dr. Yvonne. We are beginning now.
Okay. Good morning. I'm Yvonne, one of the doctors over here. Can I know how to address you, please?
Thank you, doctor. My name is Adam Cook.
Okay. Can I confirm your age, please?
Yes, doctor. I'm 52 years old.
Okay. I can see from my file over here you are coming to review your high blood pressure. Am I right?
Yeah, yes, doctor, you're right. I've been told that I was having high blood pressure, and I was given this machine to my home where I was having the machine all over the day, and now I have some values that I was told to see you, doctor. Yeah.
Okay. Can you tell me briefly how is your blood pressures when you're measuring it at home? Do you
Yes,
jot it
doctor.
out in a book?
Yes, doctor. I have written, and it is 166 or 104 millimeters of mercury, doctor.
Okay,
You
can
said,
I know this on a single occasions or your blood pressures has been constantly around the same?
oh, doctor, this value is something, as an average of my blood pressure over the entire day. It's my home blood pressure actually. So yeah, this was the average of my blood pressure throughout the entire day.
Okay. Do you have any other symptoms like headache or visions problem?
No, no, not really.
Okay. Do you feel like any chest pain which you experienced before this?
No, doctor, not really.
Okay. Do you have any other complaints besides the high blood pressure? Do you experience any discomfort?
No, I'm pretty fine. I'm pretty fine in my work. I go to my work every day. I'm a businessman, and were pretty going good. And last time when I came to the GP for a different complaint, I was having a running nose, and at the time they measured my blood pressure and they found it was high. And so I was offered this machine, which I then took home, and I measured my blood pressure for the entire day. And now I am so I don't have any particular complaints apart from this high blood pressure values, which are completely. I think they are incidental, or they are coincidental or something like that. Yeah.
Okay. Do you have any no medical conditions before this?
No, no, I'm completely fine. I'm fit. I'm fine. Yeah.
Are you on any medications or traditional herbal medicines?
Oh, I just take the vitamin D supplements, doctor, because it's winter. So I'm taking those vitamin D supplements. Apart from that, I'm not taking any medications.
Okay, can I know briefly about your diet? How is your diet like? Is it like very high in salt intake?
Yeah, yeah, doc, you're right. No, I love spicy food, this Chinese and Indian ones, and I eat a bit spicy. Yeah, that's always been my diet since my childhood. So yeah, I eat a lot of spicy food.
Okay. How about your family? Anyone in your family that actually has high blood pressures before this? Like your parents, your siblings?
Yeah, yes, doctor. My elder brother has high blood pressure as well.
Oh,
Yeah,
okay. How is he doing right now? Is he all right?
yeah, doctor. He's completely fine. He's on some medications, and yeah, he's doing fine, doctor. Thanks for asking.
Okay. So from the history that I have asked from you and also your recording of the BP, I'm suspecting that you are having a high hypertension with high blood pressures, and we might need to start you on some antihypertensive medications. Is a medicines to lower your blood pressures. Do you understand so far?
Oh, doctor, sorry, doctor. You were too fast. I couldn't follow you.
Okay. So from what I have collected from you, the informations and also your records of the BP, I'm suspecting that you have high blood pressures.
All right. Oh,
Okay.
really? All right. Okay.
So from our end, we can try to start you on antihypertensive, which is a medicines to lower down your blood pressures.
All right. So, like my brother is taking. All right.
Okay. But there's also on your end, you can do something, some of the other things that you can be done, which is you can try to have a more healthy diet with lower salt content.
Oh, really? All right, doctor. So I should not eat spicy food anymore.
You can just to try to cut down it and also have a lower salt intake. And
All right.
also at the same time, you can try to exercise. Are you physically active? Do you like exercise currently?
Oh no, doctor. I'm quite busy with my work. I work in the stock market,
2 minutes
and
remaining.
I don't get the time to do exercise at all.
Okay, so maybe like from now on, you can try to do some exercise. Like you can park far a bit away from your place of work and
Yeah.
started to consider walking.
Yes, maybe I should, doctor. Yes.
Okay, so I will start you on some medications to help lower down your blood pressures. Do you have any allergies to any medicines or food?
No, doctor. For now, I don't know that if I have any allergies. No.
Okay, so I will start you on these medicines and I will see you back in 2 weeks' time. Are you okay with that?
Yes, doctor. That's completely fine. Yeah.
Okay, so if you experience any side effect or any discomfort like dizziness, chest pains, or any headache, you can come back earlier.
All right, doctor. Yeah. Where should I come to the GP surgery?
If you experience any chest pain or severe headache, you can straight away go to the emergency department. But if
All
you
right.
feel like any discomfort is caused by the medicines, you can come back to me as well.
All right, doctor. That's quite helpful. Thank you very much.
Okay, thank you.
Yeah. Thank you, Dr. Ewon.
Move on to the next station.
Yeah. So it was 1 minute remaining. So you finished 1 minute soon. That's fine. So how did the station go for you?
Actually, I'm pretty new to prepare PLAB-2, so I think I did quite badly.
And that's fine. That's fine. No worries at all. When is your exam, doctor?
April.
April. Oh, it's 4 months from now. That's fine. All right. That was a very good attempt. I would say it's very nice, and you followed a very good structured way, and you correctly did a recap, and you ruled out the red flags, and you asked about the risk factors, which are very good. Yeah, and coming to the from the triple R regimen and triple R, when you came to the explanation part, one thing which you could have did is you could have elicited about my ideas about what I'm having in my mind and what my concerns are, because I told that my brother also is having this high blood pressure. So you did a very great task by asking how my brother is doing, because that's something which is very important. Whenever a patient says gives a positive family history, it is highly important to ask about how the family member is doing now, because that can be hugely reassuring for the patient. So you did a great task by asking how my brother is doing, which is very good. And the next question should have been that, like how you are feeling, and do you have anything in your mind what it might be, or do you have any particular worries, like you know, do you think that this might impact my work? So in which you could have asked one thing. And
Okay.
so yeah, and when you're closing, you can give more options, right? So it's in this scenario you had 1 minute remaining, so even more things like, you know, so I told that I was businessman and I was working in the stock market and I didn't have any time for exercise. So simply telling the patient that you should exercise more, that's something which everybody can do. Just telling is actually very easy than doing. So one idea is that what you could have did here is that, so since the patient was a 52-year-old businessman who works in the stock market, there are high chances that he is using a car. So he will definitely be using a car to commute in most cases. And if that's the case, you can ask the patient to park his car maybe a half a mile or a mile from his workplace and ask the patient to walk from there. So that's a way where he could make some time rather than allotting walking as a separate exercise in his daily life, which can be very difficult for him. You can advise ideas like, Mr. X, park your car next time, park your car about a mile or half a mile from your workplace, and from there, park your car and walk to your workplace. So that's something which can help the patient save their time, and simultaneously they can do some exercise as well. That's one thing. And number two, you did a very good thing by giving dietary advice to restrict the in my diet. And when the patient asked that should I completely stop my spicy food, you gave a good response that you need not entirely stop your spicy food. You just have to reduce the amount of salt and in the diet. And other thing which you can have is that rather than just simply telling to take a healthy diet, you can be more specific, like giving evidence-based things like eat more fruits and vegetables which are proved to help with high blood pressure. So those are the things which you can include in the management, because as I mentioned earlier, in these type of scenarios, your entire focus should be on the management rather than the history taking. And history was concise, which is very good. And try to focus more on the management, and you will sound better. And you did really well. And congrats.
Thank you.
Yeah,
And
and
sorry, doctor, just to
yeah,
confirm again, like when I explain to the patients that I have to start him on medicines,
yeah.
do I need to specify the name of the drug just so that he actually has an idea what is he taking?
Yeah, that's a good question, Doctor Yvonne. So you need not necessarily mention the medication. It's because there are certain guidelines. For example, in this case, if you are planning to, I'll tell you what to do. If you are somebody who wants to tell the medication, that's completely fine. But if you are telling the medication, it should be according to the NICE guideline. For example, as you are aware from your PLAB-1, so patients below the age of 55 should be started with AC inhibitors or ARBs, and more than 55 should be on calcium channel blockers, right? That's the guideline. And for Afro-Caribbeans, be it any age, we have to start with the calcium channel blockers. So you have to see the race of the patient on the exam day, and you have to tell the medication name depending upon which ethnicity the patient belong to, and what is the patient's age. For example, we don't know the ethnicity of the patient here in our scenario. So here the patient is Adam Cook, a 52-year-old businessman whose age is below 55. So he will be a candidate for AC inhibitor or ARB. And yeah, and also if the patient has diabetes, we are going to give him AC inhibitor or ARBs despite his age. So those are the things which you have to keep in mind when if you are planning to tell the medication's name. However, you will not be marked, I mean, it is not a negative thing. It is not a negative thing not to tell the medication, because you are not usually expected to tell the name of the medication, because you will not be independently giving the medication to the patients without asking to your senior. So it is a safe thing to, or it's a good thing to mention that Mr. Cook, I'll be giving some medications after consulting with my seniors. which can be fine. And even if you are planning to tell the name of the medication, add a word that I will confirm with my seniors. Does it help?
Okay, yeah, got it. And
Yeah.
also for the if he experience any reflex symptoms or any side effect from the medicines, so should he go to the emergency straight or come back to the GP?
Uh, you are asking for the red flags, or are you asking for the side effects of the medications?
Uh, both.
Both. All right. So if the again, that's a good question again. So if the patient has any acute symptoms like sudden chest pain or sudden loss of vision or sudden onset headache, so any urgent symptom or any symptom which has developed rapidly have to be directed to the emergency department, right? So any symptom which has been developing over a period of time, say for example, if the patient is having a dry cough, which is the common side effect of AC inhibitors, in that case, we should not advise the patient to rush to the A&E for a dry cough, which is arising because of AC inhibitor, which is an expected side effect. So again, it depends upon which symptom comes to the patient, and it depends upon the context of how fast the symptoms develop and how severe they are. So again, if you are not sure, you can ask the patient to dial 111, so they can be in a better position to help if the patient should go to the A&E or should come back to the GP surgery. It is 999 for ED, emergency department, and it is 111 for GP surgery, and which are for non-urgent things. Does that help, Dr.
Yeah,
Emo?
yeah, yeah. Thank you
Yeah,
so much.
good. No worries at
And
all.
how?
Yeah,
One last question. How about the follow-up period? Actually, how long should I review the patients back?
follow-up period. All right. So that's actually quite subjective, and there are no clear guidelines on that about the follow-up period. And in this case, again, you are giving medications, and it's completely fine to tell that will be follow up in 2 weeks, because 2 weeks is a general term which we use for many conditions. And again, we don't have many cut and dried guidelines because different practices use different guidelines. So it's completely subjective, and it depends upon our senior colleagues as well. So I think um telling 2 weeks for, as you I think you mentioned, 2 weeks time in this consultation, I think that's fine.
Okay, thank
Yeah.
you.
No worries at all. I'm more than happy to help. Do you have any more questions? And a general thing, I hope you are aware. And when you are addressing the patient, so he is 52-year-old. So most of the patients, who are pretty older than you, it's a good practice to ask in the beginning of the consultation, how can I call you? Does he prefer to be called by his first name or by his last name? If you are calling by the first name, it is just Adam. It is not Mr. Adam, right? So if the patient asks you, just call me Adam, so you can call him Adam. However, if you choose to call the patient by his last name, it is Mr. Cook, right? So it is not, if you are using Mr., you have to use only the last name. You should not use the first name. So Adam is an informal way of calling, and if you want to call him in a formal way, it is Mr. Cook. So this is something which I want to tell, which somebody for somebody this might be new. So please have in your mind, friends, it is either Adam or it is Mr. Cook. It is not Mr. Adam. Hope it helps. All right. So any other doubts, friends? Anybody, does anybody else have any questions? CB, would you like to add something to the station?
So, like in the previous station, Manikandan was explaining, doctor, you had doubt about medications. So, what we should understand is we are all foundation year doctors, and that is the level of competency they expect when you talk to a patient in the PLAB-2 examination. So, you don't need to explain about pantoprazole. You just need to tell the patient that this medicine will reduce acidity in your stomach, or this medicine will reduce blood pressure in your body. This medicine will not allow your blood to clot. So please make sure that you don't think of yourself as a consultant and give out information in that level, and make sure that you give out information in a very uh, sensible way, because what they expect you to do is to make sure the patient is fine, the patient is doing all right at the moment, and the patient is taken care of in case of emergencies. So always keep this in the back of your mind that you are just a foundation year doctor and not a consultant, and give out information in that way. And when in doubt, always go back and look in the BNF or ask your seniors. That's what I would tell.
Yeah, thank you, Sivi. Yeah, that's very important. When you are planning to give out any medication, you will have to look at the BNF. BNF will be kept almost in all stations in most cases. So if there is a BNF and if you are planning to give a medication, it's a good thing to look at the BNF and tell them. And as Sivi told, it is please have in mind that we are all tested based on the competencies of a foundation year 2 doctor, and foundation year 2 doctor in most cases don't prescribe medications independently without the advice of a consultant. At least start medications independently unless it is an emergency or it is a urgent scenario. Good. Does anybody have any other questions?
Dr. Manikan, do you have another question where
Yeah, we have another scenario. If somebody wants to practice,
yeah, you can ask one of them, Dr. Jaya, Dr. Zana, Dr. Raja, Dr. Arigan, and anyone of
yeah,
you please volunteer and
yeah,
get practice.
yeah. So let me go through the scenario. You are in foundation year 2 in general surgery. Emily John, a 28-year-old teacher, presented with right lower abdominal pain today. Examination and CT scan are suggestive of appendicitis. Your task is talk to her, suggest a management plan, and address her concerns. So it's again another pretty straightforward scenario. Does anybody want to volunteer, friends? All right, Rajsekhar, shall we begin?
Hi, sir. Shall I see the scenario once again?
Yeah, sure.
Teacher.
Yeah,
Okay, sir. So these examination finding and CT is from her last consultation. Am I right?
yeah. Today she presented, and they have did an immediate CT scan which shows
Okay.
appendicitis.
Okay, sir. Okay, sir.
So whenever you're ready, we can begin.
Yes, sir.
When the end of
Let's
recess
start.
stage.
Shall we start?
Okay, sir. Yes, sir.
Good.
Hello, I'm Dr. Raja, one of the surgeons working in this hospital, and you must be Emily John. Am I right?
Oh, yeah, yeah, doctor. Yeah, I'm Emily.
Okay. I think you came to this hospital by the evening and with the complaints of abdominal pain. Is that right?
Yeah, doctor. I came today morning. Yeah, I had some pain in my
Okay.
tummy. Yeah.
Okay. I got to know from my colleagues that they done some of the examination and CT, and I have the CT scan report in my hand. Before that, before moving to the report, can you tell me more about this pain? If you are okay, are you comfortable now?
Yes, doctor. Yeah, I'm in a bit of pain now, but I can talk. Thanks for asking. And yeah, doctor, the pain started early in the morning today. It was in my around my belly button, and I thought it would
Okay.
go away, but I didn't go. And I took some acid medication, which I got over the counter, thinking of that it might be due to acidity or something. So I took the medication, but it didn't help. And
Okay.
and since the pain got worse, and I came to the emergency department, and now I'm
Okay.
the pain is no more in the belly button. It has moved toward the right. The pain is on the right side.
Okay.
And yeah, doctor, I have been given some painkillers which are helping, and yeah, the pain is a bit better now. And yeah, and I was told that I was sent for the CT scan, and I was told that I will be told the results of the CT scan by you. So I'm waiting for what's happening and what's going on.
Okay, I feel really sorry for all your pains and difficulties. I hope for betterment of your health. But before discussing about the CT results, is that okay if we have a chat little bit? Because I want to get to the bottom of this. I need to make sure everything else is fine before coming to the diagnosis.
Yeah, yes, doc, please. Yeah, that's fine.
Okay. You told that you took Ranitide, right? I mean, a drug to reduce your acidity,
Yes, I
right?
took a medication. Yes, doctor. Yeah.
Okay. And it didn't do much with the pain. Is that
No,
right?
doctor. Yeah, that's right.
Okay. Okay, fine. By any chance, do you have any vomiting?
Oh, I did vomit for one time, doctor. Yeah, in home.
Okay. So was you able to drink water, or did you have some food or something?
Yeah, not really, doctor. I didn't get hungry, so I didn't eat anything, and now I am getting
Okay.
fluids, so they are helping me. Yeah.
Was there any fever?
Not really. No, no fever, doctor.
Okay, fine. So what do you think you might be having? You have any idea about it?
Yeah, doctor. I'm pretty sure that it can be appendix because my friend also had appendix operation last month, and she also had the pain in the same area which I'm having now. And I called her, and she told that yeah, there are chances that this might be a problem with my appendix. Yes, doctor.
Yeah, you're right. Appendix could be one of the possible cause for abdominal pain, and
Mm.
since all the symptoms and signs and all our examination is also suggesting the same, appendix is also could be the possible cause. And from your CT finding, it clearly shows that your appendix is inflamed. You know what appendicitis is? Do you know anything about it?
Doctor, appendix. Yeah, I know that appendix is a organ with no use, which is present, and it can sometimes cause problems, and people remove it. Yeah.
Okay, okay, fine. You're right. And actually, we won't remove the appendix if it doesn't shows any symptoms or if it doesn't have any problem. If it doesn't cause any problem to the patient, there is no need to remove that organ. But if it is inflamed, particularly if some food particle get lodged inside the abdomen, it will obstruct and causes some inflammation, basically, and which is called as appendicitis. Only
Mhm.
in that case, we need to we need to open the patient's belly, and we need to cut the appendicitis. We need to do appendicectomy. Okay, because if we didn't do it, then it might rupture. It might rupture, and all the food particles which contain harmful bacteria may leak out to our abdomen cavity and causes severe inflammations and severe diseases. Okay, so I think we might need to proceed with the surgery. And regarding that, are you okay with proceeding with surgery?
Doctor, I'm sorry, I couldn't follow you. You were too fast, doctor. Could you please repeat that for me, please? You mentioned that there is something called inflammation. I'm not sure what it is, and
No problem, no problem. See, like I said, see, appendix is a small tube-like organ. If the food particles get dislodged or causes a obstruction to that tube, it will leads to an accumulation of all the food particle, and basically it get enlarged, and with sometimes it will get inflamed. So that is called as appendicitis. And most patient,
Few
the one
minutes
the
remaining.
one of the most proper management plan would be appendicectomy, which is basically operating the appendix and cutting it down. Okay, are you able to follow?
yeah, doctor. You mean you will just cut the appendix and will you remove it from my body?
Yeah, yeah.
All right.
That's what we do basically.
All
Okay.
right.
Are you okay with that?
Yeah, doctor. If that's the option, if that's the recommended option by you, then I'm okay with it.
Okay, fine. So, regarding all the procedure of surgery, what we'll be doing, I will ask my surgery colleagues, general surgery colleagues, to talk with you, and he'll be explaining everything about operation, what we'll be basically doing, how we will be basically doing, and all our anesthetic team will come and have a consultation with you. Will that be fine?
Yes, doctor. I'm fine with that.
Okay. So, all the better. I mean, take care. I'll ask my colleagues to have a consultation with you. Okay?
All
Is there
right, doctor.
anything else you want to know? Is there anything else you want to know?
Oh no, doctor. That's all. Yeah.
Okay. Thank you.
Thank you, doctor. Thank you. Yeah.
Move on to the next station.
So that was 30 seconds remaining. Sorry, that was 30 seconds remaining, and you finished at 7:30. So how did the station go? How did the station go? What is your feedback on your performance, Rajsekhar?
I don't know. Since they already did the examination, I shouldn't go to the examination part. So what I can only do was basically history taking,
Mm-hmm.
and since all the history you given is more than enough, so I thought to come to the management part.
Right, that's
I
fine.
don't know. Mm.
Good. So a few things which I would like to tell that you did a good thing. This station was really good, I would say. You did all the good things which have to be done, and just try to keep in mind that, as I mentioned before, this is a station where I'll show the task again. So the task is the diagnosis is already given, and
Yes,
it
sir.
is pretty clear that it can only be appendicitis. So you need
Yes, sir.
not ask any differential diagnosis here because it's suggestive of appendicitis. And
Okay.
so the task is to talk to her, suggest a management plan, and address her concerns. So you talked to her and you suggested a management plan.
Yes,
However,
sir.
unfortunately, Raj, you didn't use the word concern throughout the consultation. Yes, you asked about, do you want to know anything else at the end when you were about to close? But it's a good practice to ask about what is the patient's concern, right?
Mm-hmm.
So because here she is a teacher, so a teacher having appendicitis, so she will have to skip days of work from her
Mm-hmm.
daily, and it can
Mm-hmm.
have some impact. So what if she has an important class, or if something which is very important is going on in the school, and we don't know if it's some training program or something is just going on, and so things like that. So it's always a good idea to ask about. You did a very good thing by asking what the patient's ideas are. So what the patient's ideas, what do you think it might be? That's very good. And immediately after ideas, you have to ask about what her concerns are. Do you have any particular concerns, Emily? So yeah,
Okay.
like that. So since she is 28 years old, which is roughly approximately near uh, an average PLAB-2 candidates, or nearly half your age. So if the patient's age is pretty close to you, and if you're comfortable with, then you can call the patient by their first name in most cases. So yeah,
Mm-hmm.
so that's that thing. And so as I mentioned, ask concerns and inflammation. Inflammation is a medical jargon. Not everybody know what inflammation is. Though some people
Okay.
may know, it's always a good practice to even tell simpler words like soreness, right? So
Okay.
your appendix has become sore. That is even a better term, right?
Okay, sir. Okay, sir.
So tell them that your appendix has become sore, and that's what we call as appendicitis, right?
Okay, sir.
Good. And one thing I would like to ask is such, and you probed about the medication which the patient took. You asked about what medication they took, and you again rechecked about the medications which they
Yes,
got
sir.
over the counter. Do you had anything in your mind? Were you suspecting anything when you asked about it?
Mm,
Do you think that it is relevant in this particular scenario where you are specifically asked to give a management plan and address your concerns?
mm, no, actually, I thought of inquiring about it, but
Mhm.
I didn't have any particular reason for that.
All right, that's fine, Raj. Okay, so again, so this is where we can save our time, because if it were a diagnosis station where you are expected to arrive at a diagnosis from a simple symptom of abdominal pain, that's a totally different scenario where you will be asking everything basically. So any medications, what medications, because NSAIDs can cause gastritis. So here the patient straightforwardly told you that it was medication for acidity. So
Mhm.
I think it is not necessarily to ask the patient again about the medication and wasting a minute of your time there, because it can be used
Okay,
effectively in the management, right?
okay, sir.
Yeah, so the entire history in this station should be less than 2 minutes, and the remaining 6 minutes should be spent exclusively in the management and addressing the patient's concerns.
Addressing concern. Okay,
Right?
sir.
So that's one thing.
Okay.
And yeah, and so when you explained about the condition and you explained the treatment, it is very important that you pause in between and check the understanding of
Yeah.
the patient.
Okay. Okay,
When
sir.
we, yeah, appendicitis is a small thing for us, for the surgeons, and for us, for the medical professionals, because we see appendix every day, right and left. It's even called the bread and butter of general surgeons. So that's something which is very common. However, uh, unfortunately or fortunately, we all have only one appendix, and we can have appendicitis only once in our lifetime. So that's a once in a lifetime experience for the patient, but it is a daily job for us. So we can see, for in our eyes, appendicitis is a normal thing and which we see every day, and which is not an interesting thing to do. But for the patient, it's not like that. So it's something which is very, very important and sometimes very scary for the patients. So we should be speaking from the perspective of the patient. So patients' concerns are more important. And what if you can imagine in this way, what if we are not medical professionals, and if we have appendicitis, and how our mindset would be then? If you could reflect on
Mhm.
that experience and that kind of emotional experience, how the patient might be feeling. So that's something you can reflect upon, and you can alter the tone and alter your speed of delivery of information, so that you are really sounding convincing to the patient, right?
Okay, sir.
Yeah, are you able to follow?
Yes, sir. Yes, sir.
So just try to be more empathetic with the patient, and try to your speed. I mean, your delivery of words was very good. You spoke very slowly and clearly. What I'm telling is, give adequate pauses and check the patient's understanding. Are they really following you? Because they can completely go out of the box when you tell that they are having appendicitis. What, because the patient will subconsciously start thinking about what might happen next, and if they are subconsciously thinking of what is happening next, they are not listening to you anymore,
Okay, sir.
right? I
Okay, sir.
get it. So when you are telling something significant, pause there and check if the patient is really understanding it,
Okay, sir.
right? And that's one thing which you can note down. And again, the same comes with surgery. When you're offering surgery, tell them that this has to be, say, Emily, from the information you gave me, and from your examination findings, and from the CT scan which you took, um, we suspect that there are high chances that it can be a condition called appendicitis. Pause. Do you have any idea about it? Now, the patient will tell whatever the experiences or the ideas they have about appendicitis. So it is, and we are eliciting information about what the patient is knowing. Right. So
Mhm.
now, Emily, I know that it is not an easy task to go through. It's not an easy thing to have this. And I know that you are in pain, and you told that you are a teacher, and this can have implications on your work as well. And Emily, do you want to know more about the treatment for it? Patient will say yes. And now you tell about Emily, this condition can be treated only with surgery. That's the most effective way of treating the condition. And in this surgery, we'll be removing the appendix. In most cases, we'll be using a keyhole surgery, which is the laparoscopic appendicectomy. You need not tell the term laparoscopic appendicectomy to the patient. In most cases, we will be doing a keyhole surgery where we will be removing the appendix, and we will be sending it to the lab, and it will be a it is a very common surgery which we do it every day. And there is an option for open surgery as well. However, I'll discuss with my senior colleagues and let you know what the exact surgery we are doing on you. And you can ask about, or does the patient have any preference? Or is the patient okay with the surgery? Or are you okay with the surgery? And sometimes now the patient can open up. You see, doctor, surgery, I'm afraid of surgeries, I'm afraid of operations. Or sometimes the patient may say, yes, I'm completely fine, we can go ahead with the surgery. In sometimes, some patients might be refusing blood. Some patients will have some religious things um, which can defer them from receiving blood. So those concerns can arise at that point of time. Or some patients can be worried about the complications which the surgery can bring, and the patients can ask you about what are the complications which can arise from the surgery, or what will happen if I don't give my permission for surgery. What is the consequence? And that's when you mention the complications, right? You mentioned that this can burst and cause infections, right?
Mm.
So
Yes, sir.
that's something which you should tell when the patient asks about what will happen if we don't treat the condition, right?
Yes, sir.
So if the patient straight away consents and agrees with the surgery, then I don't think there is any need to tell about the complications of the surgery. Again, complications of the thing. Again, it's not a bad idea also to just tell them, and just to give the patients about the information, right? So you decide
Okay,
upon
sir.
the time you have. If you have the time, tell them. If you don't have the time, don't tell them. Again, as I mentioned before, it's about the priority. Tell the important information first, and tell the less important information next. So that's one thing.
Okay, sir.
Yeah, and that's about it. And I think otherwise it was extremely fine. It was very good. And congrats, Rajsekhar. And
Thank you, sir.
Sibi, do
Thank
you
you, sir.
have anything to add? No, sir.
No, Mani, I think we've covered pretty much everything, and there's two good examples of a station. And I think if anyone has any further questions, we can address that and we can conclude the session.
Yeah.
Thank you.
Friends, does anybody have any other questions? Rajsekhar, if you have any other questions, please feel free to ask, or anybody else, Dr. Ewon,
Sir,
else. Yeah,
actually, if we consider the management plan for appendix, either we can consider it as a subacute appendix and we can go for interval appendicectomy. Or if we consider it as a emergency appendix, I mean acute appendix, then we should go to the surgery right away. So, is it up to us to decide the management plan, or what should we do?
yeah. That's a good question, Rajsekhar. Thanks for your question. And as CB and I mentioned earlier in the previous station, we are tested in PLAB-2 based on the level of foundation year 2 doctor. All right. Yeah. So for FY2 doctor is not the one who makes decisions on whether to operate or not. We will be um, asking our senior colleagues, the consultant or senior registrars, who will be making a decision whether to operate on the patient. However, appendicitis is a condition, is a very common condition, and we were pretty much sure that the golden line of management for appendix is appendicectomy, right?
Okay, sir.
So
Yes, sir.
these are conditions where you can actually tell that has to be treated by an operation, and subacute and interval appendicectomy is a decision which the consultant takes, not the FY2 level doctor.
Okay, sir.
right? So I think it is a good option. It's a good idea to just tell appendicectomy, and I will talk to my seniors, and as you rightly mentioned, my senior colleagues will come and talk to you more about the procedures, what we are exactly going to do, and about the risks and other things, the operation and the anesthetic assessment and things like that. So that's something which you should have in mind. Don't try to complicate the management. Make it as simple as possible. As we discussed the previous scenario, when it comes to medications, it becomes complicated when we try to figure out what medication we have to give in this particular condition, because there are different guidelines for different trusts and things like that. So when it comes to medications and when it comes to the surgical approaches, it is completely fine to leave them to our senior colleagues, and we have
Okay, sir.
to behave at a FY2 level doctor, right?
Okay, sir. Okay, sir.
Did that help, Raj? Did that answer your
Yes, sir.
question? Yeah, good,
Yes,
thanks.
sir.
Yeah, right. So anybody else have any other questions, friends? Please feel free to ask. You can comment in the chat box. We'll wait for a minute and then we will conclude the session.
Okay, and guys, next week we have our next, series, next session in our webinar series, and that will be the last session for this year. And we will continue it again from the beginning of next year. We'll have 2 more sessions in January 7th and 14th as well. So I hope you guys will join us for next week as well, and we'll get the maximum out of these webinars. Thank you.
Thank you, friends. Have a good day. Thank you.
ఎందుకు పాప నువ్వు తీసుకునేది ఫోన్స్
మ్యూట్ చేసేకి
అది మ్యూట్ లోనే ఉంది
అవును అన్మ్యూట్ చేసా